Welcome to Have More Babies. I'm Stella, and today we're embarking on a really crucial exploration. We're looking into something that's genuinely transforming family healthcare, pediatric telehealth. And look, this isn't just about convenience, though that's part of it. It's about empowerment, access, and honestly, sometimes just preserving your sanity as a parent, right? We've gathered some excellent source material, including insights from Omega Pediatrics, our mission today, to kind of distill the most important information, giving you a clearer, more confident grasp of this whole evolving healthcare thing. The term telehealth, it's become almost background noise, especially lately. But when it comes to our kids, what does it really mean for your family? Is it just, for a quick cold, or is it something more substantial? And wow, there are so many options popping up. How do you even start choosing the right platform for your child? Those are the big questions we want to tackle.
Absolutely. And you're right, it's not just a flash in the pan. This is a fundamental shift. It offers incredible flexibility, which parents need, and critical access, especially when life gets, well, hectic, which it often does with kids. So we'll start by grounding ourselves in the core concept, just making sure we're all on the same page about what telehealth actually is. Then, yeah, we'll move into spotlighting some of the key platforms innovating in pediatric care. We'll look at what makes each one a bit different and maybe ideal for certain family situations.
Okay, perfect. Let's really get into the nuts and bolts then. When we say telehealth based on our sources, what are we actually talking about? Give us that foundation.
Well, at its core, it's pretty straightforward. Telehealth is basically about using electronic communication tools, things you probably use every single day, like your phone for calls, texts, video chats, to deliver healthcare services and information remotely, from a distance. Think of it like, well, it's really about bridging distances. So a healthcare provider can connect with a patient, no matter where they physically are. Our sources do highlight its big benefits for folks who might face mobility challenges, like the elderly. But the implications for busy parents, they're just as profound, maybe even more so. It's about bringing the doctor to you instead of the other way around.
That makes immediate sense, especially with kids. I mean, just the logistics, right? Getting a child to an actual physical appointment can feel like planning a small invasion sometimes. So for parents specifically, what are the real game-changing benefits our sources mention? Why has pediatric telehealth become so popular?
Oh, absolutely. That logistical operation is a huge factor. The material we looked at really drives home some very practical wins for parents. It's more than just saving travel time or gas money, though that's nice. It's about vastly more flexible scheduling. Imagine your child wakes up with some weird rash on a Monday morning.
Yeah.
Instead of that mad dash, maybe being late for school or work, pulling them out later, you might get a quick video consult before the day even really starts.
That would be amazing.
Right. Or that nagging worry, maybe about a potential ear infection keeping you up. A virtual visit can often get you answers without that whole trip to a waiting room that's probably full of other sick kids. I think the real insight here is how it reduces that decision fatigue for parents.
Oh, yeah.
It minimizes that whole agonizing process of, is this symptom bad enough for a disruptive clinic visit? It offers peace of mind and, quicker action for minor stuff.
That idea of reducing decision fatigue really hits home for me. It's not just saving an hour, it's freeing up that mental space, which, as a parent, feels absolutely priceless. Okay, so this is where it gets really interesting. Our source material mentions several premier pediatric telehealth platforms. Each one has its own unique angle. We can't possibly cover all 12 today, but let's highlight a few that really show the innovation and the diversity in this space.
Definitely. And understanding these different approaches can genuinely help you, the listener, figure out what might fit best with your family's specific needs and priorities. Because these aren't one-size-fits-all solutions, Recognizing their strengths is really key.
Okay, let's kick off with one called Blueberry Pediatrics. What's their standout feature? What makes them different?
What's particularly compelling about Blueberry Pediatrics, I think, is their team-based model. So they offer video visits with a dedicated team of board-certified pediatricians. And when we say board-certified, we mean doctors with really extensive, rigorous training specifically for kids' health, top-tier expertise. Their services cover a pretty wide range. Sick visits, well-child checkups, which are crucial, important behavioral health consultations, and even lactation support for new moms. But the core strategic difference is having this team, often 3 pediatricians, working together. It kind of creates this virtual medical home.
Interesting.
Yeah, it ensures consistency. So even if your main pediatrician isn't free right then, another team member who knows the system can step in. You get continuity, maybe even diverse perspectives. Plus, they have a messaging service, too, for those non-urgent questions that always seem to pop up.
That team approach sounds really smart for ensuring consistent care. Okay, now, Tido Care. This one sounds like it's taking things up a notch, almost bringing the physical exam into your house. How does that work?
Indeed, Tido Care is pretty unique because it tackles one of the big limitations of older telehealth, the
Hmm.
lack of a physical exam. It basically empowers parents to do a basic physical exam on their child using this small handheld device. Yeah, it's quite smart. It's got a high-res camera, a thermometer, a stethoscope for listening to heart and lung sounds, and even an otoscope to look inside ears and throats. The really revolutionary part.
Hmm.
Parents can capture high-quality images and audio. Think like a clear picture of a red throat or the sound of a specific cough,
Okay.
and then securely share that data with a healthcare provider during a live video visit. This just fundamentally expands what a doctor can diagnose remotely. It's way beyond just looking.
Yeah, I can see that.
It significantly boosts the accuracy of remote diagnoses, and it also lets you track your child's health data on an app, keeping this sort of digital health record.
That's incredible. Being able to literally show the doctor instead of just describing symptoms must be a massive relief for parents. Okay, moving on, Maven. This one seems to take a much more holistic view, looking beyond just the kids to the whole family unit.
Right. If we connect this to the bigger picture of family well-being, Maven really does stand out. It offers comprehensive telehealth services specifically geared towards women and their families. So you get access to a wide range of professionals, OBGYNs, mental health specialists, and yes, pediatric providers too.
Hmm.
But it goes further than just appointments. They offer crucial wellness services, things like expert lactation support, personalized nutrition coaching, even exercise programs.
That's comprehensive.
It is. And what's particularly powerful about Maven is their focus on personalized care. They actually use a sophisticated algorithm to carefully match patients with providers based on their very specific needs and preferences. So it creates a really tailored healthcare experience for the whole family, kind of anticipating needs at different life stages.
Okay, now when we talk about just sheer availability, maybe 200/7 access and a broad range of services, Teladoc often comes up. What's their angle in the pediatric space?
You're right. Teladoc is definitely one of the big names, known for its huge network and accessibility. They provide access to board-certified physicians across many specialties, including pediatricians and also mental health practitioners. Their service list is quite broad: urgent care, primary care, dermatology, behavioral health.
So pretty much everything.
A lot, yeah. But the real distinguishing feature is that 247 access to healthcare providers. That offers just unparalleled convenience for those immediate needs that always seem to happen outside of office hours. Oh,
Oh, absolutely. Middle of the night fevers.
exactly. Imagine your kid spikes a fever at 2 a.m. Teladoc aims to connect you with a doctor right then who can offer guidance, maybe call in a prescription if needed. That round-the-clock availability is a massive plus for parents dealing with unpredictable kid stuff. Plus, their mobile app makes scheduling visits and accessing health info pretty easy and secure.
Now, a really big factor for so many families is cost. Healthcare expenses can be a huge worry. Are there platforms mentioned in our sources that really make a point of being transparent and affordable with their pricing?
That is such an important question. Financial concerns are absolutely top of mind for many parents. And yes, both Sesame Care and Virtual are highlighted as great examples of platforms championing transparent, flat-rate pricing.
Okay.
Sesame Care, for example, lists its prices right there on the website before you book anything. So no surprise bills later, which is a relief.
That's huge.
It really is. Virtual takes a similar approach, offering flat-rate pricing, specifically for visits with nurse practitioners. And these visits can often be significantly cheaper than a traditional doctor's office visit.
And nurse practitioners can handle a lot.
Oh, absolutely. They're advanced practice registered nurses. They can diagnose, prescribe medication, provide comprehensive care, often at a more accessible price point. So platforms like these make quality expert care more predictable and affordable. That's a major benefit for families watching their budgets.
So we've touched on quite a few different platforms, each with its own strength. But, with all these options, it can still feel like navigating a maze for a parent. What are the key things our source suggests you should really be looking for when trying to choose the right telehealth platform for your family?
Yeah, it can feel overwhelming.
Yeah.
But the source material gives some really invaluable practical guidance here. When you're evaluating these platforms, it's critical to weigh several factors to make sure it's the right fit. First, just think about ease of use. Is the app or website intuitive? Are the instructions clear? You really don't want to be fumbling with technology when you're already stressed about your kid being sick. Look for something simple.
Makes sense.
Second, look closely at the types of services offered. Does it just do urgent care? Or does it offer a wider spectrum? Maybe you need mental health support or help managing a chronic condition or specific pediatric services like behavioral therapy. Make sure it actually meets your needs.
Right, not just general stuff.
Exactly. Third, consider the availability of healthcare professionals. Is it a big network or are the options limited? This really impacts how easily you can get an appointment, especially if you need one quickly or at an odd hour.
Yeah.
Fourth, and this is crucial, security features. You're sharing really sensitive personal health information. So it's absolutely essential the platform uses strong security. Look for things like high-PLA compliance that ensures they meet strict medical privacy and data security standards.
Very important.
Definitely. And finally, of course, cost. Understand that pricing structure inside and out. Is it a monthly fee? A per-visit charge? Does your insurance cover it? Be really aware of any potential extra fees or hidden costs. Transparent pricing, like we talked about with Sesame Care and Virtuel, is a huge plus here.
That's a fantastic checklist, really practical advice. It really sounds like telehealth is way more than just a temporary fix or a Band-Aid solution. It feels like it's genuinely advancing healthcare in some powerful ways. What are those broader, overarching benefits our source material emphasizes for patients and the healthcare system?
Yeah, if we zoom out and look at the bigger picture, telehealth is delivering some pretty significant benefits across the board. One huge one is convenience and accessibility. We've talked about busy parents, but think about families in rural areas where the nearest specialist might be hours away, or families with physical limitations. Telehealth just opens up access that wasn't there before. Plus, being able to schedule appointments outside the standard 9 to 5 minimizes disruption to work, school, everything.
That's right.
Then there's time saving. We keep coming back to it, but it's major. Eliminating travel time, parking headaches, sitting in waiting rooms, all that time saved adds up. It's more time for family, work, or just catching your breath. The source also points out its critical role in providing immediate medical aid, especially in situations that aren't life-threatening emergencies but still need quick assessment. This idea of remote triage is really powerful. A provider can quickly assess things over video or phone that guide you on whether you really need the ER or if urgent care is okay, or maybe you can manage it at home. That saves time, stress, and unnecessary exposure.
That's a great point.
And finally, cost effectiveness.
Yeah.
This benefits everyone. Patients save on gas, time off work, maybe childcare. Providers can potentially reduce overhead costs. And a benefit that became super clear during the pandemic is reducing the risk of healthcare-associated infections. Virtual visits kept everyone safer by minimizing exposure.
That's incredibly powerful stuff, and it makes total sense why so many parents are not just trying telehealth, but really integrating it into how they manage their family's health. It's clearly here to stay. Now, we mentioned our source material for this came partly from Omega Pediatrics, and they actually offer telehealth services themselves, don't they?
Yes, that's absolutely correct. Our sources explicitly state that Omega Pediatrics has made telehealth a key part of their service offerings, which means they provide a convenient, accessible option for families dealing with a whole range of things, from routine checkups and follow-ups to managing minor illnesses, even providing support for mental health concerns. They really encourage parents to explore these benefits by booking a telehealth appointment with their own experienced providers. It shows they're committed to this modern, patient-focused approach.
Wow. Okay. What a journey through the world of pediatric telehealth. It's so clear that this is way more than just a passing trend. It's a really vital, evolving, and incredibly helpful part of modern family healthcare. We've seen the whole spectrum, haven't we? From specialized platforms like Blueberry Pediatrics with their team model, to the really comprehensive family services of Maven and just the sheer convenience from places like Teladoc. There genuinely seems to be a solution out there for many different needs. And importantly, something to make parents' lives a bit easier and more informed.
Indeed. And while telehealth offers these amazing advantages, convenience, access, peace of mind, it is equally important to remember its limits. It's not, and probably never will be, a complete replacement for every single in-person visit. Sometimes you just need that physical examination, maybe lab work, or a hands-on procedure for a proper diagnosis and treatment plan.
Right. Important distinction.
Absolutely. But for a huge number of common issues, for ongoing support for those initial assessments, it's an indispensable tool. It's efficient, often less stressful, and really helps parents navigate their children's health effectively. It just transforms how we think about getting care.
So what does this all mean for you listening right now? Well, if you're a parent and you're looking for options that are more flexible, more accessible, often more convenient, whether it's for a sniffle, a rash, or just ongoing support for your kid's health, exploring pediatric telehealth platforms is absolutely worth your time. It's really about using technology to smooth out some of life's bumps and make sure your kids get the care they need when they need it. And look, for even more specific information that's directly related to everything we've discussed today, including how you can easily book a telehealth appointment for your child with dedicated professionals. We strongly, strongly encourage you to visit omegapediatrics.com. That's OMEGAA pediatrics.com. Think of it as your essential hub for details on their services and how they can support your family's health journey. Seriously, go check it out. We truly hope this discussion gave you a clearer picture, some solid insights, maybe even sparked a new idea for approaching your family's healthcare. If you found this helpful, please take just a second to like this video, subscribe to our channel for more conversations like this on crucial topics. And please, share it with other parents, other families you know who could really benefit from this information too. Thank you so much for joining us on Have More Babies.
Thanks, everyone.
We'll catch you next time.